Good morning, Mrs. Johnson.
Good morning.
I'm Nurse Betty.
Hi, nice to meet you.
How are you doing today?
I'm doing good.
That's good. I understand that you're new to SLU Medical Center?
That's correct.
Correct. Okay, well, what brings you in today?
I just really haven't been feeling well, and I just wanted to get checked on.
Okay. What type of symptoms are you experiencing?
Frequent heartburn and nausea and shortness of breath and kind of like a tightening in my chest.
Have you ever been tested for heart disease?
No, I haven't.
Well, Ms. Johnson, if you didn't already know, this month is Heart Disease Awareness Month. And from hearing your symptoms, it is important that you get tested.
Okay.
So now I'm just going to go over some information with you about the disease.
Okay.
And coronary heart disease is also known as coronary artery disease. It is the leading cause of death in the United States for both women and men. It's the narrowing or blockage of the small blood vessels that supply blood and oxygen to your heart. This often leads to chest pain or even a stroke. Coronary heart disease is caused by the buildup of plaque in the arteries. This may also be called atherosclerosis. So the plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. The buildup of plaque occurs over many years, so it's not really something that just happens. Fatty material and other substances form a plaque buildup on the walls of your coronary arteries. The coronary arteries bring blood and oxygen to your heart. This buildup causes the arteries to get narrow. So as a result, blood flow to the heart can stop or slow down. And there are actually 500,000 adults in the United States that have heart disease. 20,000 people are diagnosed each year. And is actually responsible for half of all deaths in the United States and other countries, totaling 17.5 million people. So did that help any, Mrs. Johnson?
Yes, it did.
Do you have any questions?
No, I don't. You pretty much covered it.
Okay, well, it was nice meeting you.
Nice meeting you too.
And the doctor will be in shortly.
Okay, thank you.
Thank you.
Hello there. Ms. Johnson, right?
Correct.
Okay. In turn, I'm just going to be taking your blood pressure for the doctor and relaying some symptoms to you right quick. Let's see here. See your arm here. Okay. So I looked at your chart. You're here to get a checkup on some symptoms you think you may have. Coronary heart disease?
Yes.
Is that correct? Okay. You're 45?
Mm-hmm.
You're kind of young to be 45.
Thank you.
Let's see if we can get this. So, you're having any chest pain, dizziness?
Yes,
weakness? What about shortness of breath?
Yes, that as well.
Okay. Let's see here. Any vomiting or anything like that?
No.
Not at all?
Not as much as all my other symptoms.
Okay. Any chest in your sternum area?
Yes.
They call it a gena. It's very intense pain right up on the sternum. Let's see. Since you're a lady, your symptoms are very much restricted to shortness of breath, dizziness, weakness, nausea, indigestion. Plus, have you have any sharp pains in your arm radiating from your jaw, throat, area
Now
like
that I
that?
think about it.
Okay. What about any neck pain? Have you had any symptoms like that?
Not really.
Not really?
If I do, I normally just take like ibuprofen for it.
Okay. Well, aspirin is pretty good for this. I don't know if you know anything about that. Let's see. Ask you that. I've asked you this. How often have you had those symptoms? Is there a stable pattern or unstable pattern?
It's like after, at the end of the day, it seems like. So like when I wake up in the morning, I like feel okay, and then I go through my daily activities, and then I feel like I experience this.
Do you have a symptom of shortness of breath after you do any extreme exercise? It looks like you're kind of healthy, so do you have shortness of breath?
I do,
after
actually.
exercise? Okay. Okay, let me write this down for the doctor. And once again, I think those are all the questions I wanted to ask you regarding that? Any other questions you had about this?
No.
Something that I didn't ask you anything about that you may want to relate to the doctor?
No.
Are you sure?
Yes.
Okay. Well, I think I'll take this to the doctor and he'll be in shortly.
Okay, thank you.
How you doing?
Good.
My name's Dr. Moore.
Nice to meet you.
I heard that you having heart disease, may have heart disease.
Yes.
Alright, I'm going to go over some risk factors.
Okay.
About 10 of them. They have controllable risk factors and uncontrollable risk factors. Uncontrollable risk factors are your age, your sex, your family history, and your race. Controllable risk factors are smoking, high cholesterol, high blood pressure, sedentary lifestyle, and excess weight, and sometimes diabetes. Some of your uncontrollable risk factors, such as age, they say you're 45, so that doesn't put you at high risk, because usually if you're over 65, you have an 83% chance of getting heart disease. You're not male. Men generally do have a greater risk than females of getting heart disease. Even after females go through menopause, they still don't have a high death rate as men when it comes to heart disease. Your family history, do you have anybody in your family that had heart disease?
Yes, my great-great-great-grandfather had heart disease.
Alright. By him having that, it still puts you at risk too, because it's still genetics. For race, African Americans, Mexican Americans, American Indians, Hawaiians, and some Asian Americans generally do have a higher risk of getting heart disease than Caucasians, just based on the food that they consume. Sometimes it's not too healthy. So that doesn't put you at risk too much. Smoking, do you smoke?
No.
Alright, because smoking definitely increases your rate of developing heart disease. High cholesterol, is your cholesterol high?
I think so. I think it was.
Alright, that puts you at risk of coronary heart disease.
Okay.
High blood pressure. My intern told me when you took your blood pressure, it was pretty high. That's going to increase your heart's workload, causing the heart to thicken and become stiffer. That puts you at risk for getting a stroke, a heart attack, kidney failure, and even congestive heart failure. A sedentary lifestyle, do you consider yourself active or inactive?
I would say I'm kind of in between.
Alright. By being more active, that puts you at a less risk, and by being inactive, it puts you at a risk just because you don't get out much and your body doesn't function as well. People tend to have excess weight, especially around the waist area, tend to develop heart disease. It's because of, and maybe sometimes even stroke, even if you don't have any other risk factors unnamed. And diabetes, that's a controllable and an uncontrollable risk factor. Sometimes you're born with it, or sometimes you just get it. Having diabetes seriously increases your risk of developing cardiovascular disease. About 3/4 of the people who with diabetes die from heart disease or blood vessel disease. So I told you some of these. I'm going to let the next doctor come in and talk to you about some other stuff.
Okay, thank you.
See you later.
Hi, Ms. Johnson. I'm Dr. Alyssa.
Hi.
How old are you? 45?
Yes.
And you're here today for, you think you're having heart problems?
Mm-hmm.
Okay, well, in case you do have coronary artery disease, I'm going to go over some of the treatment plans that they might want to give you. The treatment for coronary artery disease, it depends on your severity of your disease and the symptoms of it. So along with a healthy lifestyle, you might be put on like 1 or 2 medications. Are you on any medications right now?
No, I'm not.
No high blood pressure?
No, I have high blood pressure, but I haven't been put on any medicines.
Okay, well, they'll just put you on some medications to treat your high blood pressure. And then in addition to medication, you might be asked to go to a cardiac rehab program.
Okay.
And then if it's too severe, then you might have to have heart surgery. Some of the medications they'll put you on are aspirin. Are you familiar with aspirin?
Yes.
That'll just help prevent the formation of blood clots. You might also be put on beta blockers to help lower your blood pressure, as well as diuretics. Have you ever taken a diuretic?
Yes.
And that, are you familiar with what that does?
Yes.
That decreases the fluid in your body, so that'll help lower your blood pressure as well. And then statins. Statins are another popular medicine, which is Lipitor. Have you heard of Lipitor? That's an example of a statin, and that'll help lower your LDL levels in your blood. Now, if you do require surgery for your heart disease, there's angioplasty, which angioplasty, they take a special balloon-tipped catheter and they stick it in the coronary artery, and then it's inflated and it widens the artery, and then in most cases this is followed by stent placement, and the stent is inserted and expanded and then remains in the coronary artery. Another procedure is coronary artery bypass surgery. In coronary artery bypass surgery, they take a healthy artery or vein from your venous vein in your leg, that's in your leg, and they connect it to the blocked coronary artery in your heart. And this new artery or vein bypasses the blocked portion and it reroutes the blood to the healthy heart muscle. And you can have up to 4 major blocked coronary arteries bypassed during one surgery. And then another option is minimally invasive heart surgery. So we're going to have Dr. Brooke come in here, and she's going to talk about the tests they're going to run on you, and then talk to you about the healthy lifestyle changes as well.
Okay.
Hi, Ms. Johnson.
Hi.
I'm Brooke. So I hear you're at risk for heart disease, or
Yes.
you may have it borderline.
Yes.
Okay, the doctor would like to run some tests. He's got a few in mind. I'm going to tell you about all of them,
Okay.
just so you have a good understanding. One of the tests is a coronary angiography or arteriography, and that's an invasive test that helps evaluate the heart arteries under an x-ray. We also have the CT angiography, which is a lot less invasive and a lot better to do than the other one. We have an echocardiogram and the electrocardiogram, also known as the ECG. You're probably familiar with that or heard of it. We have electron beam computed tomography and EBCT, which just checks for the amount of calcium in your arteries. As you know, the more calcium, the higher the risk you are for heart disease. There's also an exercise stress test, a heart CT scan, a magnetic resonance angiography, and a nuclear stress test. Now, the doctor is probably going to put you with the ECG and the exercise stress test just to start things off, and then we'll kind of go from there based on your results.
Okay.
So you'll set up an appointment with the nurse out in the lobby. We're finished here. Up here, this poster, we have some lifestyle changes that we recommend to take preventative measures against heart disease or to help come at it. If you drink, I don't know if you're a drinker, but if you drink, cut down to like 1 glass of wine a day, 1 12-ounce beer, just 1 serving alcohol. And you exercise?
Yes.
Okay, well we just recommend you get at least 30 minutes a day, 5 times a week, and cardio, running, things like that is better because it works your heart.
Okay.
If you smoke, I don't know if you smoke.
No.
Okay, that's great because that's not very good for your heart. As far as your diet goes, it's best if you eat more whole grains and lean protein and fish and legumes and all that stuff. It's a lot better. And then if you could avoid or limit the amount of baked goods, processed foods, sodium, fried foods. And also if you could limit the animal products, like milk and not all milk, just like the whole milk, 2% milk, and eggs and cream, things that are heavier and have more cholesterol. We'd like it if you switch to the light yogurts and the like 1% skim milk, those types of things, and eat some omega-3 foods.
Okay.
And as a woman, it's better if you take omega-3 supplements. So you can find those at the drugstore if you want to pick some of those up. And lots of fruits and vegetables. So just any, whatever sounds good to you.
Okay.
Okay, do you have any more questions?
No.
Okay, and you can see the nurse in the lobby to make an appointment.
Okay, thank you.